Obviously, there are other challenges which some of my panelists are going to discuss. That we are talking of the bottom of the pyramid. Mr. Siddharth Singh just mentioned about wanting to reach the last man or the last mile. Good, I think that's a great thought. But how do you get the doctor there? How do you get the institutions there? The scheme, the vision is excellent. I think is one of the most innovative, ambitious, and challenging programs which the government has embarked upon. We all talk of primary healthcare, secondary and tertiary, and that's another thing I want to touch on because I want my panelists to cover that. I had the privilege of speaking at the World Medical Assembly where I expressed my views which were very different because I was running a comprehensive healthcare facility in a tier 3 rural setup. And our roadmap to the government, how to ensure that this great envisioned scheme of Ayushman Bharat sees the light of tomorrow. I invite Mr. Vedish. Vedish is the president of OPPI, the managing director of GlaxoSmithKline, one of the global giants in pharma manufacturing.
Good afternoon, everyone. India is a very unique healthcare system where almost 60% of the healthcare is being delivered by the private players, and government plays a very big role in delivering healthcare through the supply side financing. We are well placed for a big transformation as far as healthcare. Know that the government is looking at prevention also as part of the program, but it doesn't have the same level of visibility and highlight like what we are talking about, the illness insurance program. I strongly believe that we need to motivate people to figure out how to manage their health in a preventative basis rather than spending money behind the illness. Thank you very much.
So good afternoon one and all. I bring greetings from Indian Medical Association. We should focus on shift of the outflow towards the peripheral centers and the primary and secondary care providers so that they can upgrade themselves as the funds flows into them and also give effective care to the beneficiaries at their doorsteps. Empanelment must be uniform and all the eligible clinics or the hospitals should be empaneled irrespective of the number of the hospitals or anything in that particular area, which will unnecessarily, if the selective empanelment is there, that will lead on to bribery and fraudulence. So with this short notice and the informations, I thank and for the opportunity given.
Vivek, your brief views on how healthcare at home could be a solution or one of the solutions towards a speedy implementation of the Ayushman Bharat program.
Thank you. So, just briefly, what all do we do so that you understand the context I'm talking about? We have two parts of the business. One is what you can say hospital at home kind of services, right? So delivering whether it's oncology or chemotherapies at home, setting up ICUs at home and so on. So delivering even tertiary care at home, right from the primary side till tertiary. And then there is a second business which we do, where we work with pharma companies, where we work with the pharma companies across the patient journey, right from creating awareness of diseases to each and every step which comes after that, whether it's screening, diagnostic, managing disease management programs on chronic diseases, and then collecting the outcome, etc. So if we keep some part of the premium itself to take care of a situation where anyone who's diagnosed of these kind of diseases gets on a program, and hence we prevent that hospitalization phase or the acute phase to come in, it will save a lot of money for the for the insurance providers itself. So those 2 points in my view should be taken into account when we are building these programs. I'm sure the other things are already being done.
The reason is because for us, two things are very critical. One is the consumer and the second is use of technology, right? So, and hence we would also want to define our category as InsurTech, right? So now when I look at using InsurTech in the whole Ayushman Bharat implementation, I look at three things. One is enrollment. Enrollment of the 10 crore families into the whole Ayushman Bharat piece. The second is claim settlement, I think, which is very critical from a healthcare delivery provider to manage their cash flows. And I think the third, which I look at, which is a bigger question that at some stage, somebody will have to answer, is the feasibility of the whole Ayushman Bharat piece, right? If you look at from a retail perspective, a 5 lakh cover for a family of, let's say, somebody who's in mid 30, roughly costs about 8 to 10,000. Now, 8 to 10,000, and there is no, and there is underwriting, and there could be loading or there could be rejection. In this, there is no loading, no rejection, nothing, and the premiums could range between 1,200 to 1,500. Reduce the cost of, let's say, healthcare delivery. Can we increase efficiencies to reduce that cost so that the whole model of Ayushman Bharat becomes feasible from an insurance standpoint? See, fundamentally, if you look at what does an insurance company do? It's actually funding or financing the healthcare spend. The insurance companies, using their tech and using their data analytics, working with partners, can help, I'm not saying will, can help in figuring out how do we bring efficiencies in the whole healthcare delivery so that costs can come down.
So, the packages must be scientifically designed which will be viable. Unless that is designed, the healthcare providers, the service providers, automatically either the service will be poor or they have to look into some other ways and means to make the profit.